So, given all of this good discussion we've had today about the upside of plastic surgery after weight loss, let's give fair balance to some concerns. After all, these are big surgeries with lasting implications, and people should not go into them with rose colored glasses. I myself am still dealing with a complication 2 years out from my surgery. So, in that spirit, please give us a top line on the biggest things that a patient needs to know and watch out for when considering plastic surgery after weight loss. And I've got a couple of areas that I'd like to cover. We could take them one at a time. So, let me just run through them first. There's results and expectations, there are risk, there's recovery and complications, relationships, and body image and identity. So, if you want to talk about results and expectations first.
Well, I think that first of all, these are very, very large procedures, as you know, and it's a specialized area of plastic surgery. Uh, you know, and everyone has its variability. In other words, the patient as well as the physician, and again, as we mentioned, if somebody tends to operate longer, it's been shown that the chances of complications are greater. By complications, we're talking about not scars, okay, because I wouldn't consider a scar a complication, but things like infections, things like wound breakdown, and probably a seroma or a fluid collecting, I would even consider a complication because that occurs in a number of patients too. And let me talk about the scars too. In most cases, people are aware that there's going to be scars, and I found in my practice that the patients aren't really that concerned about the scars. I'm probably more concerned about the scars than they are. But I always stress the scars, and I try to make the scars as small as I can. One area where the scars tend to be the worst is actually on the arms. Okay, and I think that I've seen in a number of forums that patients have talked about this and are more aware of this. But the scars can be pretty tremendous. I mean, they could be red raisin spread. I mean, to an inch off the surface and whatever. An inch wide. So I think that I try to make the patients aware of these because if they're not, they're going to be unhappy to a certain extent. But I think that scarring is probably secondary to the result that they want to achieve. Okay, so a lot of times they'll put up with scars in order to achieve a better result. So from that standpoint, I think that's one thing. That the other there's certain things that are sort of out of our control that I worry about, and that's like a pulmonary embolus or that blood clot. That scares the heck out of me because that's something that I don't have under my control. We take every precaution at surgery in order we have stockings that inflate and deflate during the surgery, but then it's up to the patient to go ahead and move around. So I always get my patients up the next day moving around, or if they don't move around, at least they're moving around their legs in order to keep everything circulating. But even in that particular instance, I mean, they still may have problems. So, I think that once you have enough experience in this field of dealing with the bariatric plastic surgery problems, I think that tends to hopefully limit the problems that these patients can experience. If somebody is a neophyte in dealing with these operations, a tummy tuck is not the same as a lower body lift. A tummy tuck in a 120 pound person is not the same as a tummy tuck in a 150 pound person that's lost 200 or 300 pounds. I mean, they're totally different. They're specialized area of plastic surgery. So a lot of these things, basically need to be taken into account. Also, as I mentioned, the longer that one operates, the higher the complication rate has been found. So, I think that that's really important too. I set myself a limit of probably 5 to 6 hours, and basically, if I can't accomplish that in that particular time, which I don't think, if I don't, then I don't do that procedure, or I don't combine the procedures. I go ahead and separate the procedures. So again, there's a lot of variables, and hopefully, the plastic surgeon that the patient has chosen has enough experience with these particular procedures, that they're going to be judicious in telling the person what to expect and what not to expect in all these different areas.
So I think we've talked a lot about the risk, recovery, and complications. Do you find that how can a patient be sure that she or he is going to be realistic about their expectations? Because you know, obviously, this sort of financial investment is a lot for most people, and then they see a lot of really glamorous before and after photos of patients, and obviously everybody's body is different. So because somebody looks one way after going to a specific plastic surgeon does not necessarily mean that I'm going to look that way because I'm an individual. So how do we make sure that and I'm talking again about sort of the concerning side of plastic surgery, what to look out for. How do we make sure that we have realistic expectations going into this of what our results will be?
Well, I think that's one of the problems with all of plastic surgery and all of cosmetic surgery is how do you go ahead and give the person a realistic expectation of what they're trying to achieve, and unfortunately, in most cases, you're seeing that particular person for the first time, and probably see him maybe two times before the surgery, and you're trying to gauge what's in their mind and what they expect, and what they're going to be happy with and what they're not going to be happy with. So as you can imagine, it's fraught with the possibility of error. Fortunately, I think that more of the services are available, such as yourself, that basically can where they can get more knowledge about what to expect, not only before the surgery, during the surgery, and after the surgery, as well as the results. I think on our website, the American Society of Bariatric Plastic Surgeons, we have a wide range of results that are there. Some of them aren't that pretty, okay, but we put them up there because basically they are realistic to a large extent. And so I think by patients going to all these different informational areas, resources, they're hopefully able to take advantage of them and come up with a realistic expectation of what they're going to achieve and what they're not going to achieve. And if they don't, then they're not going to be happy.
Yeah, a lot of it is really the patient's mindset and their own perception of self, and a lot of that goes more into psyche than to anything else. Um, so that kind of segues into what I was asking about relationships and body image and identity. So I know some relationships between married couples that have improved after their weight loss and after their plastic surgery, and I know some that have not, and the people have gotten divorced, as well as with body image and identity. If women have been obese most of their life, they may not be comfortable with attention from men that they're all of a sudden getting almost overnight, because this transformation happened so quickly that it's almost mind-blowing if you don't stay very grounded. So can you talk about these last 2 points, relationships and then body image and identity?
Well, I think first of all, I'm not, even though I see patients day in and day out with their problems, perceived and not perceived. I mean, I don't have a degree in psychology, so
Hmm.
I can't tell you totally what's in their psyche. And as I said, I mean, if we're seeing them, one time or two times before the surgery and then after it, sometimes I'm like flabbergasted when when they have a tremendous improvement, and after the surgery they're complaining about a small little thing. So before the surgery, it's hard to gauge in probably a half an hour visit or something like that, what exactly they're going to be happy with and what they're not going to be happy with. But we do the best we can, and fortunately it's worked out pretty well. But most patients, as I said, have a realistic expectation, and the other thing, I may put in there too, is that I always try to stress with the patient that if you come in with damaged, goods, so to speak, okay, you can expect that it's going to be improved, but it's still going to be damaged. Okay, as
Hmm.
far as interpersonal relationships are concerned, it really depends because again, you don't know what's going on with the individual. A lot of times, I see that all of a sudden, as you mentioned, that the the person who's had the plastic surgery, all of a sudden they're getting more positive feedback. I mean, whether it's because of their new body, whether it's because of their new face, and sometimes I think that maybe the husband or their significant others, all of a sudden, the relationship has changed because the person who has been dependent because they've sort of shunned the spotlight, all of a sudden can become independent and stronger because they feel more self-confident. And there's no question that these procedures give a tremendous self-confidence and tremendous boost to the patients that have undergone them. So there again is very very variable. Just like people are variable as far as their color is concerned and their appearance. That's just how their psyche is. But the bottom line is that from my perspective, in my estimation, in my experience, this particular surgery, not only after weight loss, but actually most of plastic surgery, I would say there's probably almost a 90% psychological improvement rate that basically they feel better about they look better and they feel better about themselves. They're more self-assured, and I think that it improves their quality of life. There's no question about it.
Yeah, I actually hadn't expected that, but it was a profound effect on my emotional well-being. I am so very very happy now, so much more positive, and I've seen that in so many patients. It's just like a flower blossoming, and it's absolutely wonderful.
Yeah, and I think also, even the patients that have had complications, okay, that have had prolonged recoveries, things like that. They're still they would still not go back in most cases. They still accept and are happy with their results.
Sometimes I wonder it would be really quite the experience if we could just go back for like say 30 minutes and be our former obese selves even before the bariatric surgery, just to really really remind ourselves what that how difficult that was, what
Right.
a difficult life that was.
Yeah, but people tend to forget. People tend to forget how they looked, and that's why a lot of times people say, "Well, how come you're taking all these pictures?" It's because because basically you want to show them, where they came from. So a lot of times you forget. I mean, you don't want to remember that, as you said.